I have to say, when I first asked my colleagues, the co-editors, to help pull this book together, I don't think we imagined there'd be this level of interest.
We believe passionately in the health of individuals around the world, and we need to join together and in one voice say that climate change is the biggest risk to human health in the world.
We felt that our colleagues didn't know as much as they perhaps should. In fact, we didn't know how much there was to get to know about climate change. This was, in a sense, putting a book together for ourselves and all our colleagues.
I think health practitioners can do a great deal about this whole problem. For one thing, they're trusted by the public. I mean, not just doctors and nurses, but a whole range of other health professionals as well. They're held in very high esteem by the public. So the way they feel about links between health and environment and society are important, and people will respect that.
When you look at the health profession, the NHS, doctors, nurses, midwives, it is in some ways our absolute duty to protect public health. It's what we were trained for. I mean, we do deal biomedically with individual diseases on a one-on-one level with patients, yes, but at the end of the day, our core remit is to protect the health of the population and very much implicitly the planet.
The rest of the world has huge respect for the National Health Service, and I think we can set a really good example to the rest of the world by making changes in the NHS in this country.
I think the first thing that health practitioners should do to try and prevent runaway climate change is to acquaint themselves with the facts about climate change and use your moral authority, because there is so much moral authority that health practitioners have out there in the community.
Health practitioners, not just doctors, but all health practitioners, ought to make it very clear through their personal action that they hold this thing to be serious. One of the problems, of course, is that we as doctors or health professionals think we're the good guys already, and it's a fait accompli. You don't need doctors to do it. It's all those nasty power stations or what have you. But in fact, it's really important that health services, health professionals, doctors, be the change they want to see.
Each of us individually, if we can make some changes to our own personal lives and to our families' lives, and if that can happen across the whole, so to say, the whole of the health service, the whole health community, then suddenly the whole thing grows, and before you know where you are, you have a movement, a real movement.
Get to know who your local politicians are, political leaders are, go and talk to them, question why some things aren't done, and start to get active in this agenda, because actually we're in the midst of a war, and we have to deal with it through collective, assertive effort.
Well, it probably doesn't need to go along and wave placards. I suspect that's not what Copenhagen's about. What I think it needs to do, and articulate it very well, is to go and see the people who are representing the UK and saying, these are the quantitative reasons, put numbers on it. This is the health it will improve, and the health it will improve now, not in 50 years, the health it will improve now.
I think that health practitioners, as a health community, by getting together, acting collectively, have a really powerful voice, and not just in terms of how they can change other health professionals or how they influence the public, but also how they influence the policymakers, the politicians.
What's good for climate is good for health. And we want our leaders to understand that.
If we can shift the politicians' thinking and get them to realise how important the whole body of people, such as health professionals, feel about climate change, in a way, collectively, we can arm our politicians so that they can actually be quite persuasive when they get to Copenhagen.
Climate change is a problem, but sustainability, which is a broader issue, is a solution. In that if we learn to act and behave within our resources, there's a very positive, there are win-wins all round. And so actually you can alert people, you can make people aware, you can even frighten people, but you've got to rescue them immediately by painting very positive pictures of what the future really can be like if we act, and if we act now.